Back in May of 2011, I came down with a variety of symptoms I didn't know what was causing. First, it started out is I started to lose visual clarity in my eyes. My eyes were extremely sensitive to light, and I was often finding myself bumping into objects, loss of motor functions in my hands, my speech was getting slurred, and I just felt low energy 24/7. And then I developed the worst symptom, I think, out of all 20 of them, which was my neck. I developed cervical dystonia, which was caused by my TMJ, but it wasn't true dystonia. I wasn't born with it. I don't have the gene for it. It was caused because the jaw was protecting, and the neck muscles got all tight and contracted to protect the jaw, because the jaw was overcompensating for being out of alignment. And so we went around to countless neurologists, supposedly the top in the world, and they kept associating it with my brain. They're saying, Ryan, your brain nerves are misfiring. I'm like, well, why after all these years of normal, healthy development are they misfiring? There's got to be a cause. They're like, no, there's no cause. It's just us. I said, that is baloney. I told them that. I said, that makes no sense whatsoever. And they offered me Botox shots in my neck, and then, of course, $100,000 surgery where I'd be electrodes in my head, and then they would program me on the outside with, like a pacemaker device. And I said, no, I said, something is causing this. I'm going to find out what. So through May up until practically November, I suffered. Every day was torturous for me. I didn't want to get out of bed. I slept until 4 p.m. and then my mom would be like, come on, you got to go eat. I'm like, but it's so painful. I don't want to get out of bed, because as soon as I got up, the pain was just, unbearable. And I couldn't eat anyway because it was so hard. My head was trying to jerk itself off my shoulders, and if I didn't have a spine, it probably would have. That's how powerful the muscle contractions were. So fast forward up until October, I was on my phone, lying in bed, because that's all I can do, and it was comfortable for me. I had found these people, these two guys in Virginia, Anthony and Dr. Brendan Stack, who were treating patients with movement disorders. These people had like walking problems. They had what I had, and these people developed it later in their life. And they had been told that their nerves were misfiring too. Well, they didn't know it was caused by their jaw until, this. So I told my mom about this. I said, hey, we got to go to Virginia. These are the only two people that can do it, because I didn't know about Dr. Hurme here in San Antonio. So we did the research, and luckily we just typed in TMJ doctor in San Antonio, and his name, you guys, came up on the first of the list. And we checked out the website, and we noticed he was foreign, Finland, and we knew that he was going to be different. He would try different methods than other people. And so we scheduled a consultation, and under 5 minutes he told me he can get me back to normal. And here I am now, 7-8 months later, almost back to normal. I would say I'm about 85 to 90% better now, comparing to 0 when I first came in. So it's been a pretty significant change. I'll be going back to work pretty soon. And
were you on disability?
No, they denied me disability because it was so rare. They've never heard of it. And they told me that I should be able to function, They told me that because I didn't take the medicine that they wanted to give me, which, by the way, was Valium, I would have been a zombie. You can't work on Valium. And then they wanted to hook a pump to my spine and inject baclofen, so to calm the muscles down, which would have been a risky and costly procedure. So I told them I didn't want the drugs, and I didn't want Botox. For one, it's a toxin, and it could cause osteobotulism and then mess with all this stuff right here, and I don't want that either. So because I didn't take any of the drugs they wanted, they denied me disability. So.
And I remember when you first came in, your head was
It was
Could
terrible.
you show an example, maybe?
Yeah, it was like
It
this.
was like that, and you couldn't move it, and it was
It,
so
it
tight.
was stuck there, yeah.
Yep, and then now you're back to normal.
Yeah. Well, almost back. It's still a little bit off, but I'm not complaining if I don't have any pain compared to what I had like before. Like to do the X-rays, which we're in right now, the X-ray room. It was almost impossible. The girl who was doing it says, "I don't know if this is gonna work out," because I couldn't even hold my head straight. It was just like it was like that. So, and over time, it's slowly going back, to the way it was. And another thing that when my head was like that, my eyes got really fatigued because you're trying to look forward and your head's like this, and my eyes are getting back to normal. But with all the nerve damage and all the stuff I sustained because of my jaw was pressing down on that part, it's everything's going back. My skin is a lot healthier too. There's more color in it. Before I was like a pale ghost when I first came in here. I was really pale. So that's my story so far. It's as long as I have these appliances which I'm using, I'll be fine, and I know that he will fix it to where I won't have to wear them in the future. But as of right now, I do have a very severe case, and it does have to be closely monitored, and I do have to come in every month to get them re-strengthened, so that way I can keep the symptoms at bay. But let me tell you, this is the best alternative that is out there. I can put this thing in my mouth and I can function with no surgery and no side effects. All it is I'm getting better. So I'm very happy to have the wonderful staff here at Dr. Hurme's office, and they've been working with me on payments so I can function again. Because nobody should have to go through this. Nobody, But unfortunately, it happens. But there is hope out there. There is hope for anybody that's watching this. There is hope.
Well, thank you very much.